Hi everyone. So my name is Angela Guerrero, and my question to the audience is masks really going to make a difference? Masks will definitely make a difference to prevent COVID-19. Many people are still confused about the whole situation, about the prevention of COVID. There is so much information on how masks prevent the spread of COVID just by wearing a mask and stopping you from carrying it or passing it along to somebody or getting it yourself. Both CDC and the World Health Organization now recommend cloth masks for the general public, but earlier in the pandemic, both organizations recommended just the opposite. These shifting guidelines may have confused some people on face masks and how to wear them exactly in public. Another study that looked into the coronavirus deaths across the 198 countries was found that those with cultural norms and government policies favoring mask wearing had lower death rates. Studies have compared various mask materials for the general public. The most important consideration may be comfort. The best mask you could wear comfortably and constantly is N95s, and they're only necessary in medical situations as when you intubate somebody. Surgical masks are generally more protective than cloth masks, and some people find them lighter and more comfortable to wear. Since myself, I work at the hospital, I've seen so many different types of life situations that happen that makes me think all because these people didn't believe in COVID was real, or people were like, I'm not going to wear a mask because I'm not going to get it. Mask is really important to wear unless you want to be on a ventilator and not knowing if you can come off of the ventilator, which is the ventilator is doing all the breathing for you. All for not wearing your mask, you can end up in a bed. I just call it like a rotoprone bed, which I can demonstrate to you right now what that looks like. We actually have one right now in our ICU, and it's pretty sick. And what the bed does is it lays you're on your stomach, and it's helping you expand your lungs so you can be able to breathe. Majority of the time, the outcome, sadly, in COVID cases, they don't make it out, and if they do, then honestly, it's a miracle. I can't express how much CPR I have done on people that have came in for not just cooperating with not wearing a mask. And the outcome is mainly death out of majority of our cases. Can face masks help slow down the spread of COVID? And of course it can. Face masks combined with other preventive measures such as frequently hand washing and distancing can help slow the spread of COVID. The U.S. Centers for CDC recommends fabric masks for the general public and N95 for any medical staff. The World Health Organization recommends medical masks for healthcare workers as well as for anyone who may carry the COVID-19 or someone who maybe has had it already. They also recommend medical masks for individuals who are at higher risk of becoming sickly ill with this COVID, which are people 60 and older. Sometimes if you're overly obese or you have already medical conditions. How many people do you see in the stores without wearing a mask or see the mask below their nose? You see a lot, right? Those are the people that end up in the hospital with not being able to breathe. Those are the people that end up in the worst situations. Us as healthcare workers, we're pretty exhausted. We're tired. We manually prone people because at a point we ran out of ventilators. We ran out of rotoprone beds. We were running really low on oxygen because so many people were requiring it. And it was all just because a lot of these people didn't wear a mask or they just didn't believe COVID was real. And yes, the masks are uncomfortable and they are kind of hard to breathe in, especially when we're at work and we have the N95s. But is it really worth to not wear a mask and risk your life? You know, we get many people emergently to the hospital because they can't breathe and then they end up being extremely sick. I can't express how much I came around a plenty of people's situations that are really sad and depressing. How many of these family members are seeing their loved ones go on the daily? I've seen plenty of wives, mothers, daughters, you know, deciding to pull the plug on the patient because the patient was not going to make it out anymore. I've seen plenty of my coworkers shed tears, including myself, in situations like this because it's extremely sad. We would have days where we had patients die, like 3 in a row to 5 a day because of COVID. But again, my point is to wear a mask and don't let COVID fool you because it's still out there. The pandemic is still going on. We still get constantly COVID patients. And honestly, this whole pandemic has everybody kind of mind blown, especially us as we're seeing it constantly. So I recommend for you to just keep wearing your mask. Thank you.
The reason why it's important to wear a mask because it helps protect those around you. Mask helps prevent you from reaching others when worn over the nose and mouth. You should wear a mask even if you do not feel sick. The reason why it's important to wear one because several studies have found that with people with COVID-19 who never develop symptoms and those who are not yet showing symptoms can still spread the virus to other people. Wearing a mask helps protect those around you in case if you are infected but not showing symptoms. It is especially important to wear a mask when you're indoors with people you do not live with and when you are unable to stay at least 6 feet apart since COVID-19 spreads mainly among people who are in close contact with one another. COVID-19 is spread from person to person by respiratory droplets, which are largely projected when you cough, sneeze, or talk or sing. Cloth faces. Cloth face masks can act as barriers, preventing those around you from inhaling those droplets. To avoid contamination, wash your hands before putting on your mask, and again after it's in place. Wearing a mask might feel uncomfortable at first, so it is important to adjust the mask before to make sure it properly fits over the nose, mouth, and chin, and allows for comfortable breathing and speaking. So, to avoid COVID, do not touch you or your child mask while it's being worn. Don't wear the mask under your chin or your nose or the mouth exposed. Don't leave your nose or mouth uncovered. Don't move the mask while others in public. And last but not least, don't share your mask with family members or friends because that will cause germs and infection.
It's really preventing. So one of the ways that COVID-19 is transmitted is through respiratory transmission. Masks help prevent you from spreading COVID-19 or other transmittable viruses to one another, especially if you're asymptomatic, basically not showing any symptoms like fever, coughing, any flu-like symptoms. We do have 3 main masks, which is medical, N95s, and cloth mask. Medical masks are disposable. They basically just filter like large germ-like particles. N95s are also disposable, but those do block a little bit more. They do block large particles, small particles, and they prefer them over the medical ones because they cover more. We also have cloth masks, which the more layers it has, the better because it blocks out the particles. And also masks do help prevent you from getting those particles in your system and from sharing them with your loved ones or people that are around you. yeah, so make sure they are snugged around the nose, tightly fitted, and covering your chin, so I don't, obviously covering your mouth. Masks don't just prevent COVID from spreading, they also help prevent other transmittable viruses like the flu. And also a plus is that it helps with allergies like pollen, so you won't get them as bad because you do have a mask when you're outside, and well, at least in public places. Please wear a mask, even though in Texas it's not required anymore because we're at 100% capacity, but it's for your safety and others.